Welcome to the Fee for Service Dentist Podcast. Today, our guest, Dr. Teresa Scott. She's a biological dentist in the Houston or the Spring, Texas area, North Houston. Very fascinating personal story about her journey. Started her practice, graduated in 1995, started her practice 2 years later, hung a shingle, started with one operatory, started completely fee for service, and has stayed that to the point where now she doesn't even submit the insurance for the folks, and her practice continues to boom and blossom and grow. She's now in a 7 operatory office, and she also survived being told that she had stage 4 endometrial cancer and how she beat it. Fascinating personal story. I think y'all can enjoy this. As always, the Fee for Service Dentist Podcast is brought to you by Kettenbach Dental. Kettenbach Dental is proud to talk and announce their Propicil first major advancement in fluoride varnish. It's no longer alcohol or resin, and instead patients will get the treatment delivered by a mucoadhesive dimethicone gel. Leaves a smooth, silky feeling. No more grit. Contact Kettenbach today for more details. 877-532-2123. Sit back, relax, enjoy, folks. Please, if you like the episode, you like the shows, click like, share it with your friends, subscribe it, leave reviews. Any of those things help us grow our footprint and increase our ability to deliver more messages to more people. If you don't like it, well, I would appreciate if you told me. 607-624-2962 is my personal cell. Hit me up. You want to email me? It's sunnyspira@gmail.com. Real simple. Enjoy the show, folks. Have a great day.
My name is Drew Burns, and I'm a part of a small group of dentists who believe something crazy. We believe that the standard of care is just not good enough. We demand the best of ourselves and the best for our patients. We believe that the best way? No, the only way to practice dentistry is on our own terms. If you ask the dental consultants or the corporate CEOs, they tell you that what we're doing isn't smart, that fee-for-service dentistry is dead, and that the golden age of dentistry is over. Yet, while others focus on profits first, we focus on the patient first. And yet our offices are some of the most profitable in the entire country because we invest in ourselves and we are doing things right. It's our name on the door and it's our reputation on the line. My name is Drew Burns and I am a fee-for-service dentist. This is the Fee-for-Service Dentist Podcast and these are our stories.
Welcome to the Fee for Service Dentist Podcast, Dr. Sunny Spira. Today we have a very interesting guest. I can't wait to get into it with her. It's Dr. Teresa Scott, and she has a unbelievable background. I'm going to give you a little bit of her bio. She asked me when I asked her to send it, you want the long version, the short version? I said, send me whatever you got. So she sent it to me. I'll read some of it, and I'll pick few highlights, and I think plenty is going to come out in our conversation. So she is an honors graduate of St. Pius X High School and the University of St. Thomas in Houston, Texas. Graduated Magna Cum Laude bachelor's degree in bio in 1991. She went on to extend her education, got her doctorate from the University of Texas Health Center, San Antonio Dental School in 1995. So we're about 6 years apart in school. She received the Jurisprudence Award and the Award for Excellence in Clinical Dentistry while still in school. Member in good standing of the American Academy of General Dentistry, International Academy of Biological and Dental Medicine, which is going to be a very important theme, and the International Academy of Oral Medicine and Toxicology, the Holistic Dental Association, the American Academy for Oral Systemic Health. Recognizing that modern conventional dentistry still uses toxic mercury, she has assured that she is a safe office by using SMART certified and accredited by the IAOMT and a certified biological dentist by IABDM. And she also has her mastership in biological dentistry and president of the organization for March 2020. So right when the pandemic hit, through October 2023. She has built a successful practice by delivering the best family dental care since 1997. Been married to her husband, Dan, since 1999. They have a grown daughter, Ilyana, whom they adopted from Russia when she was 12, and two biological daughters, Grace and Promise, whom Dan homeschooled. She has an incredibly unique story in terms of what she is doing now and why, which I can't wait to talk about. And it all speaks to intention and authenticity in terms of her patient care, as well as her thinking outside the box approach to both her own health as well as her patients. Okay, so let's go with that. So welcome.
Hi, nice. Thank you for having me.
I could have kept going. I know you're waiting. I was like, no, a lot of this other stuff that's in here, I think we will get into as we start to discuss things. So let's start right at the very beginning. So you're a Houston gal. Talk about growing up. What was your home environment like?
I grew up, I was a oil brat, so we moved 10 times in 8 years when I was a kid.
Okay.
It wasn't, I'm an extreme introvert, so I know that it sometimes doesn't feel like that when people meet me, but it's because I've learned some very good coping skills. But basically, I, moved around a lot and didn't have a lot of friends. And my mom was really big into teaching us early on. So I skipped 2 grades because we moved so much. And so she wanted to make sure that we didn't fall behind. And so apparently, and somehow we managed to skip ahead. So 1st and 4th grade was what I skipped. And then, I just continued, graduated high school at 16, went on to college, did the 5-year plan because I didn't know what I wanted to do by the end of the 4th year.
Okay. Well, so you got one of those years back.
Go.
So yeah.
Yeah, there you go.
Yeah. Okay, now let me ask you the introvert question. Do you think you were an introvert and then moving was hard, or do you think because you moved so much that you became an introvert? What kind of chicken and the egg? What do you think?
I think I've always probably been an introvert, and then the moving just made it harder. My mom was an extreme extrovert. My brother's an extreme extrovert, and my dad was more of an ambivert. And I was the introvert in the family, and you can tell with introverts versus extroverts based on how you recharge. So if you need to be alone in order to recharge, you're an introvert. If you need to be around people to recharge, you're an extrovert. I'm most definitely an extreme introvert, happy to be alone most of the time.
Okay. Well, it sounds like then moving would reinforce the introvert part, right? So you.
Oh yeah. My mom wanted she was always determined to get me into stuff, whether guitar lessons, dance lessons, theater, you name it. She always had me in something. Right. And I'm like, so I learned some very good coping skills as a result of it. So I can generally speak to anybody, and it has given me the ability to make a conversation with a perfect stranger about very personal things, very, awesome skills for a dentist to have.
So you talked about coping. What's one of the coping things that you would recommend for folks that are on the introverted side? We have one of our docs is very introverted, and she's married to one of the most extroverted men I've ever met. And it's kind of an interesting dynamic. Edwin is over the top, and Areta is just, you wouldn't know she was there if you were in the room together. So what are some of your coping? What would be one of the things you'd say?
Well, usually introverts will choose extroverted friends because then the extrovert carries the conversation and generally they don't have to work so hard. Introverts generally don't have to work so hard when they're around an extrovert because the extroverts they suck up all the oxygen in the room. My daughters are pretty much the same way. I've got a very extreme introvert who's way, way more introverted than I am actually. And as my oldest, my 16-year-old, and then my 15-year-old is an extreme extrovert. And so they get along, they're best friends, et cetera, mostly because my introverted daughter lets my youngest just, do whatever she wants. And she carries everything, all of the energy, if that makes any sense.
Do you hire mostly extroverted type employees for yourself too?
Oh gosh, you want to know something? I actually hire for DISC.
Yeah, so do we. But
Yeah. So I hire C's, the S's, SCs. I will hire an SI or an IS, but I generally won't hire strong D's or strong I's, the ones that are sole D's or sole I's. I am, because I've been, an introvert and a peacemaker, I've been easily bullied, and I've sort of reclaimed that strength, and I'm no longer easily bullied, but I don't want to work with a strong D who will roll over me,
Mhm.
and I also don't necessarily want to work with a strong I who is more about drama and gossip and socializing than they are about work. And so I prefer to work with people who are the S's, C, I will work with a CD, but I think, the offices typically only have room for one strong D personality. I am a CDCS. So my coping mechanism, because I had a chaotic childhood. My coping mechanism was basically to, I don't know, you understand the DISC personality assessment. So S's tend to be very steady and very like this, not a whole lot rocksome, right? Where, so because my mom was a very, very strong ID, I'm not certain which one, I think she's an ID. What I learned to do as a coping mechanism was just to try to hold as steady as possible. And if there was drama going on, I'd become the peacemaker, etc. So I try to make sure that I'm, steady, etc. But it's a mask. That's a coping mechanism, because my true personality, and again, I figured out that one over the years too, because every time I took the test, it was always very, very even. C for the main temperament, and then the D and the S were very even. And I was like, how can that be? Usually it's one main, one secondary, and then the other two are like way low. And it turns out that you do the same thing. You figure out what gives you energy, and it turns out that when I'm doing the D things, I get energy. And when I'm doing the S things, it takes energy from me. I don't know how else to explain it. So that's typically how you figure it out eventually.
So let me ask you, as you're growing up, any siblings?
I do. I've got a brother. He is 13 months younger than I am. He's a mortgage broker in the Dallas area.
Okay.
Very, very strong ID personality as well.
Okay. So was there how'd you get into dentistry is the next question.
It wasn't through my family. My mom took us, I went to the dentist 3 times in my childhood, the entire childhood. So I had a friend in college who went to dental school. We started college at the same time. So she went to dental school a year before me. She went to the University of Texas in Houston. Her name's Sharon. And we were best friends in college. And my mom had wanted me to be a dentist. I'm not a dentist. My mom had wanted me to be a pediatrician for my entire life. And that was, I was always a very well-behaved kids, et cetera. And then what happened is, in my senior year of college, I went, wait a minute, I don't want to go to medical school. What do I do now? And I talked to my friend Sharon, and she goes, well, what about dentistry? I said, well, tell me a little bit more about it. She goes, well, for one, you get to have a life. You're not on call, all the time. You have regular work hours and all that stuff. And I was like, all right, it sounds like something, because I knew that I wanted to go into healthcare. I just didn't want to be a pediatrician, which is what my mom wanted me to be. And funny enough, she was so invested in me being a pediatrician, she didn't speak to me for 6 weeks after I told her that I wanted to be a dentist. And then I got accepted into dental school. I did well, right, in my interviews, my DAT and all that stuff. I got accepted into San Antonio. Spent the whole first year going, oh crap, what have I done? Because that was a hard year, right? And then I did an externship in Harlingen at the community health center there. And it was like something just went click. This is what you're supposed to do. After that, I knew I was on my path. It was exactly what I was meant to do. I loved it. I was good at it. And everything went into place. So I'm absolutely certain the universe meant for me to be a dentist. I love it. I love my job.
So what was it with the externship that really set off the fire?
Believe it or not, it's just taking care of people. I'm good at it.
Mm-hmm.
I was able to, it was after my freshman year. So the only thing that they were letting me do in the community health center was prophies on kids, because it was an externship. And I just taking care of them, doing the prophies. And I was like, okay, I can do this, and that was all it took. Something clicked. After that, confidence came. No more wondering, oh crap, what have I done?
Maybe it was your mom saying, listen, okay, not a pediatrician. How about a pediatric dentist?
No, she really, she was completely, in her mind, dentists were not real doctors. And so it took her a long time to get to the point where she was like, okay, she's, it's a useful career for her to have, and it's okay for her to be a dentist. She's still, to this day, she'd be like, are you sure you don't want to go to medical school? She's an old Spanish woman. Like, for her, medical school was the be all and end all. It's kind of like, you see in some other ethnic groups too. It's really important to be a doctor or a lawyer. Like, those are big things, and it's the same thing. Culturally speaking, that was important to her.
I got you. Okay, so you graduate dental school. Let me get the date right again. 1995. What do you do next? And then while you're in dental school, do you flirt with any of those specialties at all?
No, I did not flirt with any of the specialties. I wanted to go out into the real world and actually just practice dentistry. I got hungry for that. Nowadays, I tell people, please go to a specialty. At least if you do nothing else, do a general dentistry specialty, but do that.
Yeah, GPR.
Because or even an AGD.
Yeah,
AGD, just something. Yeah, just something a little more than the 4 years, because in the 4 years you learn just enough to hang yourself.
Just enough to be dangerous.
That's it. Just enough to be dangerous. And so that, it would be good to have the extra couple of years to learn more and get more confidence, get your speed up, etc. But no, I chose to go to the community health center in Laredo because they said they were going to pay my school loans back. And I was like, yes, they're going to pay my school loans back. And then after a year of that, they reneged. But
okay, so loan forgiveness was a big thing then.
Yeah, right? It was a big deal, right?
What was your debt service like when you graduated? You remember?
117,000. I look at that now. I look at that now and I'm like, damn, people now are graduating $500,000 in debt. It's crazy.
Well, 1995. And do you remember approximately what the tuition was back then? Like it
was 25,000 a year.
Yeah. Now it's 80 to 100. So
yeah, it's crazy. It's crazy.
So it's not double. So if you're 115 and people are now 250, okay, but
now they're graduating $500,000 in debt, and the specialties are $750,000.
But yeah, you can see the projection just based on the different tuition.
Yeah, exactly. Okay. So anyway, I did the community health center thing, and
so wait. You said though they reneged on that. When did you find that out? After a year?
Yeah, I found that out in March. I started working for them in August, and in March they said, well, I'm sorry, we're not gonna pay for your loans. And I went, So in March I started looking for, I was like, wait, they're coming due. I got to pay my bills. So I started looking for another job, and found one with Dr. John Sturrock in Stafford. And I worked for him for 18 months.
Okay, now, when you were in the community center, so without the loan forgiveness, I would imagine that their pay was very much below rate, right? That sound right?
It wasn't terrible. Then again, back then I really didn't understand. It wasn't terrible. It wasn't great, but it wasn't terrible. I think they paid me $60,000 a year.
Okay.
or
So what
something
what
like
did you
that.
take from that experience? Because you're there, the better part, you were there 8 months. So what did you take from that?
I was there for a year. I wasn't there for 8 months. I was there for a full year.
Okay.
I just started looking in March. So
Okay.
anyway, believe it or not, the absolute best thing that I learned there was how to deal with kids. So they put me in charge. The other dentist who worked there was not fond of working with kids. And so they
Right.
go, all right, and we're going to give this brand new dentist who doesn't know any difference the Head Start program. Let's give her that. And by the way, we don't do nitrous, and we don't do sedation. So you're going to have to learn how to deal with these kids, pulling teeth, filling teeth, etc. Without any of those things, 3 and 4 year olds. So it made me really, really good with kids.
Okay.
In that year, I got really good with kids.
So that had to be a challenge on the introverted side, no? Because you're going to have to communicate quite freely with the kids, right? Or no?
I got really good at it because in all 3 years after my freshman year, sophomore year, and junior year in dental school, I did externships in public health centers. So the third year, I did it in Tierra Amarilla, New Mexico, which is an itty bitty little public health clinic. And it was me and the other dentist there. And I was acting like a dentist. I was doing everything that a dentist would do in this little bitty New Mexican town. And so, whether it was for adults or children. And so by then, I had gotten my skills just really, able to do what I needed to do. So working with the kids was just the psychological challenge. It made sure that I'm good with kids now. So I can work on 3 and 4 year olds generally without sedating them.
But you had a lot of experience then in school counting all this stuff. You weren't like your average.
Oh yeah.
Time. So
yeah, no, I made sure I did externships every chance we got. I was out there doing something to try to further my knowledge and my experience.
So in a year, then you go to work for about another year and a half for a private doctor, private practice.
Private. Yeah. It was an associateship to buy. And after about a year, I figured out that he was not yet ready to let go. And I was ready to spread my wings.
Okay.
And I did not want to be stuck. At that point, I'd worked for him for a year. All of his equipment was really old. And I figured out that if I bought his practice, it was a 5-chair practice. If I bought his practice, if I stuck around and bought his practice, I was going to end up having to spend a lot of money renovating it. And so I thought about it real hard, and then the other thing is I was a glorified third hygienist for him, because I worked the hours, like the Saturdays and so on and so forth. So I was like, you know what, I'm going to go just start my own practice. And so I did. I contacted Patterson Dental, and, they drew me the tiny little, I found an office space that was 1,400 square feet. It was little. And I put in, I designed it so that it would have 2 treatment rooms, because I was like, there's no way that I'm ever going to grow big enough to need more than that. Nowadays, man, it's hard for people. They sell them on all this extra space. And the one thing I'll tell anybody who's starting out is, if you're just starting out, you don't need any more than about 1,500 square feet max, But anyway, we did the whole office. We built it out. I hung out my shingle August of 97.
August of 97. So pretty much 2 years postgraduate, and that's, again, 97, still a tough time to actually do that. What did you do to select your location besides talking to Patterson, or what did Patterson help you do in terms of determining that it would be a successful location?
So I met these ladies at the Greater Houston Dental Society, the convention, and they specialized in dental offices. Like, they were realtors who specialized in finding, buildings for dental offices and so on and so forth. And so I talked to them, and they showed me several locations, and I basically looked at locations that were ready to build out, that had a good, good potential for growth. And so I decided on North Houston because my parents lived in Houston at the time, and I was living with them at that point, and I didn't want to have to travel too terribly far to get to my office. And so I basically chose, I asked them to stick within 30 minutes of that location where my parents lived. And they found me my original location, because I'm in my second location now, but they found that. And it was a good location, but it had one drawback. Otherwise, I would have stayed there. And that is it flooded. Every time it rained really hard, the water would almost come up to the door. And I was like, it's only a matter of time before it comes up again. So I'm going to have to move. So at the 15-year mark, we moved to our current location, which is on higher ground, has never flooded, will never be in danger of flooding. And sure enough, like just a few years after that, there were the hurricanes, Ian and Katrina and so on and so forth. And it completely destroyed that building, that I was in. So I'm grateful to have moved when I did.
Okay. All right. So you're $115,000 in debt still from school. Can't imagine you paid a lot off in 2 years. How much did you take on debt-wise to build out a brand new space?
At the time, it was actually not that bad. It was about 350,000.
All right. So 350. And how many rooms did you put in? Did you put in 3 treatment rooms?
It was plumbed for 3 treatment rooms. No, it was plumbed for 5.
Yeah.
Oh my gosh. I was ambitious. I thought I was going to put 5 treatment rooms in 1,463 square feet. So it was plumbed for 5, but we only put 1 chair in. And I was like, all right, it's going to take me a while to fill that 1 chair. 4 months later, I had already broken even and needed another chair. So, we put in another chair, the second chair, and we did that. The 2-chair practice, I hired a hygienist part-time at the 4-month mark. And then I hired her full-time at the 1.5-year mark. So we worked, in 2 chairs, and we did okay for 2-chair practice. We did okay for about 4 more years. And then I needed the 3rd chair. So we put in the 3rd chair. And we did that 3rd chair for the rest of the 12 years. For the rest of the 10 years that I was there, 15 years that I was there. And it was a lot. Like 3 chairs did pretty well, but I knew I had already started outgrowing it, if that makes any sense, by about the 8th year. But I was like, no, I'm not going to move. It's going to be fine. And I hung on for, a total of 15 years, but I really outgrew the space.
Okay.
So we moved into our new space that we got 12 years ago. We moved in there 12 years ago, and it's plumbed for 7 ops. And I outfitted 4 ops, and I was like, okay, same thing. I'm always like, all right, this time it's gonna be fine. And it's gonna take me for the rest of my career to outgrow 7 ops, right? No, we've outgrown 7 ops, and I have 8 more years left on my on my lease. So it's a good problem to have.
When did you go to 7 ops? When did you put the 7 in?
We went to 7 ops last April.
Okay. But you started with 4, you said?
Yeah, it was plumbed for 7. And so, we started with 4 there because we had 3 at the previous office. So I was like, okay, 4. And yeah, I've built it up, and now we've got 7 and have outgrown what we have, but I have 8 more years left on my lease. So I've recently put a plan in motion that will allow me to have more doctors, more hours, et cetera, in the same space. So right now we work 4 days a week, and it's basically it's a 36-hour work week. But what we're doing is we're going to move to 2 event. We're moving right now to 5 days a week with team 1 and team 2.
Yeah, you're staggering.
If that makes any sense. And then within the next year, year to 1.5 years, I'm probably going to bring in another associate, and then we're going to have 2 3-day weeks, where they're 12-hour days. So we'll still only work 6 hours. 36 hours a week, but we'll have room for 4 dentists and 4 hygienists. So 4 dentists and 2 hygienists.
Okay.
4 dentists, 4 hygienists. Yeah. I had to
Okay.
figure that one out.
So let's talk
doing
about
well.
it. So I'm gonna read your note about your journey into biological dentistry started when your younger daughter, Promise, had premature birth in 2009.
Mhm.
Okay, so this is now still in your primary practice, right? You haven't moved to this second
Correct.
practice, right? Okay.
We had not moved to the second one yet.
And you said you were suffering the effects of mercury toxicity and were very sick.
Oh,
and you
I
needed
was
to
so
breastfeed.
sick, and I had no idea why I was so sick.
Yeah.
So sick.
Okay, so your daughter, your premature daughter showed a lot of allergies, serious allergies, all the formula, organic, non-dairy ones, etc. And breast milk was not a choice. So,
Yeah, I dried up, so I was not able to breastfeed. And the doctors wanted to put her on the broken down protein formula, and they wanted to put her on reflux medicines because every time formula hit her stomach, she'd projectile vomit.
yeah.
And there was something inside of me at that point that said, "This stops now. I'm not gonna." I was on 12 pharmaceuticals at that point, and I was like, "No, I'm not. I'm not putting my infant daughter on the pharmaceutical train." And so I did a whole bunch of research, and I was like, okay, babies have been born for eons, and there's always been mothers who have been unable to breastfeed, or the mother died during childbirth, and then what did they feed the baby, et cetera. So I was like, there's got to be something out there, because formula as a product has only been out for about 75 years.
Mm-hmm.
So, I did my research, and I found the Weston Price Foundation, and they had a homemade formula made from raw cow's milk. And I was like, all right, of course the doctor had a bird, the pediatrician had a bird. And I was like, look, I'm willing to try it. So we did 5 weeks of the donated breast milk while I was doing my research. That was $3,800 for 5 weeks of the donated breast milk. So it's not cheap. So I was like, okay, we got to figure something else out. And she did really well on the donated breast milk.
So she did okay on the donated breast milk. Okay.
She did phenomenal on it,
Okay.
just not on formula. So I was like, all right, it's worth trying the formula, the homemade formula. So we made the homemade formula, and my goodness, she thrived. Absolutely thrived. She was born in the 3rd percentile for birth weight. And by her 3rd month, she was in the 50th percentile. She was right where she needed to be. So the homemade formula was doing really, really well for her. What's super cool is that the Weston Price he's dead, but he's considered the father of biological dentistry, which is why I talk about Promise being my entry into the holistic part of dentistry. So anyway, he was the father of biological dentistry. And what he did was he did research on the 14 longest lived societies in the world to try to find out what they had in common. And what they had in common, he also noticed their teeth, because he was a dentist, because the medical doctors will just look at everything else and completely ignore the teeth. But because he was a dentist, he was really into genetic anthropology, and he looked at all these things. So what they had in common was they had longer lifespans. They had very little heart disease, very little diabetes, very little modern diseases, right? And what he noticed about their faces and their teeth was that they had broad faces, they had straight teeth, their teeth fit together properly, they didn't get decay in their mouths, and so on and so forth. So it was like, okay, what are these people doing all in common? 14 societies that have nothing to do with each other, including like the Inuit in Alaska, right? Very long-lived societies. So what he found out was their diet. They had diets all of them had diets that were rich in saturated fats. I mean, the Inuit ate mostly whale blubber, right? Rich in saturated fats, rich in lacto-fermented foods, because they had to preserve their foods the old-fashioned ways. Rich in what was it? Fermented foods. Rich in, they'd had a lot of plants, but they ate nose to tail. They ate everything on the animal, and rich in bone broths, right? So lots of bone building minerals, which also happen to be tooth building minerals, right? Hydroxyapatite. So that was their diet. And they ended up with healthier diet. So I was like, okay, if I'm learning about that, I want my children to have a healthy diet. Promise is doing really well on the formula. I'm going to learn more about this. So for the first 3 years after she was born, I was just becoming I call it crunchy granola. I was becoming more and more diet conscious. We switched to an organic diet. I figured if she was going to be on a raw milk formula, what was good for the one child was good for the whole family. So we all switched to raw milk. We all switched to grass-fed meats. We did all of that stuff, and that helped tremendously, as far as the growth in that. But in that investigation, what I also discovered was mercury and mercury toxicity and so on and so forth. And I was like, oh, maybe this is what's making me so sick, because I was really, really sick. So in 2012, I said, okay, I really think that what I'm doing is not just hurting me, but I think it's also potentially hurting my patients. I need to learn more about it. And right at that time, Dr. Bill Glaros, he's now passed, but he was a biological dentist, one of 3 in Houston. And he, I guess, had heard about me through the grapevine. And so he invited me to the meeting that they were having of the International Academy of Biological Dentistry and Medicine. He invited me that year, happened to be in Houston, and it happened to be like in, just in a hotel close by. I think it was near the airport or something. I was like, all right, sure, I'll go. And I went. And when I went, my preconceived notion about biological dentistry was that it was just a bunch of woo. And that, they were going to talk to me more about nutrition than anything. Oh my God, was I wrong? It was the most heavily scientific meeting I've ever been to. I mean, presenting like biochemistry, and mercury in terms of mercury toxicity and fluoride as a neurotoxin and so on and so forth. They're actually like presenting real science on it. And then, so I heard, have you ever heard of the Bale-Donine method, beat the heart attack gene?
Nope.
Oh my God, do you want to read that? So one of the presenters there was, there was 2 because they're together. So Brad Bale and Amy Donine. He is an MD MD. He's not a cardiologist. She's just an MD. She's a PhD nurse practitioner kind of thing. And they did a bunch of research on the oral health connection, et cetera. And what they found out is that I think they said 78% of the heart attack 78% of the blood clots from strokes and heart attacks actually have the bacterial signature in them from dead teeth. And then the other thing that they said was 50% of all heart attacks are caused by active oral infections. And they, there were researched PubMed studies, were, real meta-analyses kind of thing. These people are geeks to the core. So anyway, they wrote the book, Beat the Heart Attack Gene. I highly recommend that you read it. And they actually have a CME course that they give to MDs, right, and continuing medical education. And at the time, they did not give any dental credit. They do now. But I took it. I took their course afterwards because that was my intro, right, perio. That was my intro to the world of biological dentistry. So I took their course when it was still not a dental thing, right? That same year, I took on the whole oral systemic connection. My mind was like, and I learned a whole lot about that whole link between periodontal disease and all sorts of issues with diabetes, stroke, et cetera. But nowadays, even more research has come out where periodontal disease is linked to Alzheimer's. It's linked to colon cancer, breast cancer, pancreatic cancer, and lung cancer. I mean, it's crazy the link that exists between periodontal disease and all these other diseases. And if we as dentists can affect the health of our patients by simply having their perio under control, holy macaroni, right? So nowadays, just this last year, I've usually taken on one subject a year in biological dentistry because it's a big thing to learn. So I started out with perio, and then I learned all the other stuff. And then this year we circled back to perio again. And so this year we've invested in guided biofilm therapy systems. So all three of my hygienists have them. And let me tell you, oh my God, they're wonderful. They're absolutely wonderful. We test our patients with a microscope before they have their cleanings. Then we do their guided biofilm therapy. Based on what we find in the microscope, we'll usually recommend a salivary test to see what other bugs are in there. And, you know, basically figure out what their risk factor is, and then, you know, put them on the appropriate therapies depending on what their risk factor is. So I've been blown away by the technology.
Okay, I want to get into the other part of this too, because I want to tie these two together now. Because we talked briefly off air that you graduated with the understanding that, listen, insurance companies are not in the best well-being of your patients and your practice, so you're going to want to be independent. Now, you had come out, you worked for the communities, you know, the one center, and now you went to work for a doc where you said you were a glorified hygienist. Have you always worked in a fee-for-service, out-of-network environment, even in your associateships?
Yes, it was always that.
Okay.
At the community health center, it was, you know, whatever that was, but I never participated in anything. I just did what they did. And then once I worked for Dr. Sturrock, he was fee for service. He accepted insurance as a, you know, like a, like, you know, but whatever insurance didn't pay, the patients paid the rest. And so it's always been like that for me. And about, let me see, I'm about 9 years ago, eight years ago, I decided to go 100%. Like, I no longer even take insurance, like as a form of payment. Patients pay me, insurance reimburses them.
Gotcha. Yeah. So you're truly the definition of I call it the strict definition of fee for service. I believe that a fee for service is equal to you have your fees for whatever services and you get paid them. If insurance covers part of it, and either way, you don't compromise on your fee schedule. Most people tell me that's definition is out of network office. The pay up front and they handle it is next. Now, when you started to get into the biological medicine dentistry part, did you change that model in your practice to be what you just said, that you wanted to be paid up front? Was there any correlation in those two things?
No, actually the correlation was more that I had continued to grow. I mean, just because I went crunchy granola doesn't mean that I stopped doing good dentistry, because that's another fallacy with biological dentists. Like, you know, a lot of the community of our colleagues tends to think that what we do is basically crappy dentistry, and nothing could be further from the truth. My reputation grew because I'm good at what I do, and that didn't change. So I still was doing damn good dentistry, and I just kept growing and growing. And there came a point where I had a waiting list of like 8 months, you know, just to get in to see me for a filling. And so finally I went, you know what, that's it. We're gonna call some patients here and go just to, you know, you pay us, insurance pays you. About last year, I finally said, we're no longer going to file insurance for our patients, because for the first 7 years, I was like, all right, patient pays us, insurance will reimburse them, but we'll file their insurance as a courtesy to them. But last year I got tired of that nonsense. I've got a team of 14 ladies, and they're spending so much time, you know, having to deal with insurance that now I was like, you know what, you have better things to do with your time than fight for money to be paid to the patient, because they pay us anyway. So give the patient a statement of services, give them a copy of their x-rays, et cetera, and then send them, you know, and that's what we did. And that is turning out to be a really good decision, because like, you know, we
gonna have extra staff.
No, I mean, literally we're busy enough as
honestly,
it is.
I think like we're not a network office, right? And I would think I could probably say 20 to 30% of the time might be handling that. We have one person specific. We have multiple offices. We have one person that handles almost all that, you know, reconciliation, claims, calling, check, you know,
there's better ways they can spend their time, like, you know, customer service.
Yeah.
Actually talking to, like, seriously, actually talking to people on the phone, helping them out, answering their questions, doing that kind of stuff. Fighting with insurance companies.
What was the impact of that change? Like, did you lose some folks?
Yeah, but we lost the ones that we didn't want anyway. You know, they're the ones who complain the most about the fees. maybe not even that,
Okay. You
yeah,
probably kept some of the people that you hoped that left.
yeah, well, it is what it is, right? Everybody always has those, we call them colorful. That one of my friends called them colorful patients. And I went, that's a
Fair
great
enough.
term for them.
Fair
They are
enough.
colorful.
Fair enough. We don't need that many colorful folks in our office. So, all right. So let's hit on. So now in 2015, December 1st, you're still dealing with the mercury toxicity, correct? Which you felt,
Yeah.
did you diagnose that in 2009? Is that when it was first diagnosed, or was that earlier?
No, it was not diagnosed until they didn't actually figure out what was going on with me until after I got my cancer.
Okay.
Like I knew I was getting sicker and sicker. We couldn't figure out why. We just knew that I had severe uh, uh, insomnia. For example, I was sleeping maybe 2.5 hours a night.
Uh-huh.
By the end of it, I was psychotic. But what it was severe systemic candidiasis as a result of the mercury toxicity. So candida becomes bioprotective when a person has mercury toxicity. And so a person will get severe systemic candidiasis to try to protect their bodies and their minds from the mercury. But, when I finally figured it out, it was actually after my diagnosis. And I went through a list of okay, what are all of the symptoms of mercury toxicity? And I just went down the list and went tick, 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 tick. And I went, oh crap, I had 63 symptoms of mercury toxicity by the time I figured it out, and then it was, okay, let's figure out how we're going to find a doctor to work with me and so on and so forth. Because I had no idea back then. I didn't have a functional medicine doctor. I had no connections to functional doctors at that point. And the conventional doctors just wanted to prescribe stuff. They didn't want to really fix the problem.
So in 2015, you were diagnosed with grade 4, stage 4B endometrial cancer, given a year to live and a 1% chance of survival.
Yep, sure was.
Okay. So you've been researching, and like you said, now you're gonna do this. What was your path now?
Well, I became biological in 2012. 2015, I guess the effects of the mercury toxicity hit me hard. Like it had been hitting me progressively worse and worse, but that was sort of my the bottom of the barrel days, when you hit rock bottom. So that was when I hit rock bottom, and my girls were 6 and 7 at the time. No, 5 and 7. Yeah, 5 and 7 at the time, and my husband was a stay-at-home dad, and he had started homeschooling them that August 2015 is when he started homeschooling them. And I started, I was having female issues, which is why I went to the gynecologist, and that was where I got my first diagnosis, and that was in October. But after they did the surgery for the hysterectomy in December, they did the hysterectomy October 29th. And I was in so much pain at that point from October 8th, where they did October 1st, they did the biopsy. October 8th, it came back as cancer. But by October 29th, which is 4 weeks later, right? So a total of 4 weeks from the biopsy, I started having pain in my hip. And by 4 weeks later, it was so agonizing, I couldn't walk. And so I went into the hospital October 28th, said, I'm having surgery tomorrow morning, but I'm in so much pain. Please help me. So they admit me, give me pain medicine to get through the night. They did the surgery the next morning. And then for 56 hours straight, I begged to die because the pain was horrific. And there isn't a pain medicine out there that worked on that. I felt like somebody had stubbed up.
Right? That was a metastasis.
Yeah, it was in my hip, and we didn't know that until December the 1st, where I walked into the radiation oncologist's office, limped in, and she said, why are you limping? I said, because I'm in so much pain. And she said, well, I have to take a CT scan anyway for the brachytherapy, because that's what they had told me that they wanted to do. Which brachytherapy is basically where they radiate the stump of the cervix. Okay, that's all it is. It's very targeted local radiation. So she widened the field of the CT scan and found there was a growth in my anterior superior iliac crest. And so she said, is this the only CT scan you have? And I said, no, they took one on October 28th when they admitted me into the hospital. So she compared the two and it had quadrupled in size. She found it had quadrupled in size in 5 weeks. And she said, I think brachytherapy is a little too little too much at this point. You're going to need more. She goes, I can offer you some radiation therapy on your hip bone for palliative purposes, but I think we need to talk about maybe, giving you some quality of life because we can no longer talk about a cure. And so, of course, they wanted me to do chemo and all that stuff. And I watched my dad and my grandma die from cancer. And I had learned all of these things because that 2012 meeting, I had listened to one man by the name of Bill Henderson on natural cancer cures. He lost his wife to breast cancer. He lost his son to mercury toxicity. His son was a dentist. And so I had that in my mind and I was like, I am not doing chemo. It's not going to happen. And they're looking at me like I'm a nut. And I'm like, it's not happening. So go ahead and do the focal radiation on the hip, and in the meantime, after I'm going to do some research. So they did 13 sessions on my hip from December the 7th through December the 23rd. December the 23rd, we went to Mexico. I did my research and found a holistic cancer treatment center in Mexico. Went to Mexico December the 23rd and did my best to detox from all of the radiation and get my strength back, et cetera, during the 3.5 weeks I was in Mexico. And I came back to Houston and, went to work. And while I was in Mexico, I was doing more research on what am I going to do when I get home? How am I going to do this? I've got to live. My husband needs me. I'm sole source of support for our family. My girls need me. There's no way that I can die, so I was determined to beat that sucker. And so I did a bunch of research again. I'm really good at going down those rabbit holes, clearly, and found out that there were quite a few different natural and holistic cancer treatment methods. And the one that just kept coming up for me, it's why I tell people, I'm like, you know what, listen to your intuition, because the one that just kept coming up for me was vitamin C. And I could not find anybody to give it to me. In Mexico, they wouldn't give it to me. When I came back home, I couldn't find anybody here to give it to me. And so I had to go through a bunch of machinations to be able to get it. But I finally was able to get IV vitamin C, and I started my IV protocol March the 1st of 2016. And within 90 days, I was in remission. I did continue for another 90 days because I was determined to kill that thing dead. And I've remained cancer-free ever since. I've never had a recurrence. It's gone. PTSD is still alive and well. And there are times where I have to talk myself off the ledge. But this month, I'm 8 years cancer-free at the end of this month. So,
it's amazing. How about your hip?
My hip is fine. I had some scar tissue from the radiation and I had to stretch. Yeah, I just had to stretch it out, and stuff. But I have bigger issues with joint hypermobility anyway. So, it was not any bigger of a deal in my hypermobility ever was. So.
Okay. So this really reinforces for you what you're doing on your dentistry.
Oh,
I
for
would
sure.
assume. So
yeah, I never want to breathe in. Like I said, the mercury toxicity, I had 63 symptoms. I never want to go back there again. So I wear the spacesuit and I wear it proudly and I'm fine with it. And my assistant wears the spacesuit because I don't want her to get sick. I have some team members that are stage 4 cancer survivors as well. Like, we don't want to go back there, and my patients wear the spacesuit too, because it's awful hypocritical if I go, well, I have to wear this and, the assistant has to wear this, but, you'll be fine. So everybody wears the daggum spacesuit, and I make sure that we take all the care necessary. And it's called Safe Mercury Amalgam Removal Technique. That's why it stands. It's smart. Yeah, the smart
So
technique.
now when you're bringing doctors into your practice, you're not bringing in doctors that don't have either interest, degree, whatever in the biological field. They have to be in sync with your philosophy, correct?
They have to, at the very least, be interested. So, like my current associate, her name is Rachel Perry. She's phenomenal. When I brought her in, she had no experience with biological dentistry. She took on all of it in a single year. All of it. We are airway centered as well. So she took on airway, she took on mercury, she took on fluoride, she took on all of it in a single year, and she's done phenomenally well. So
let
they
me
don't
ask you,
have to be biological to start with, but they do have to have interest in what I do.
In the first situation where you examine the 12 populations, did they also look at airway? Because I would imagine those nice wide arches and the articulating of the teeth run a lot better when you have a good clear nasal airway.
Correct. So they did not correlate it because they didn't have CT scans back then. But they're understanding now that have you ever heard of Dr. Francis Pottinger?
No, I have not.
Okay, so Weston Price discovered, that whole part about that. And then Francis Pottinger was a doctor a little bit later, not much later, but he did work on 900 cats over the period of 10 years to figure out the effects of nutritional injury on the cats. So cats are supposed to eat raw meat, raw milk. That's their diet, right? Raw meat, raw milk. And so that's what he did. He just, he gave one population what they were supposed to have, the control group, raw meat, raw milk. And the other groups, he gave cooked meat and or cooked milk, right? So, and the cooked milk was either pasteurized milk, evaporated milk, powdered milk, or sweetened condensed milk, because let's add sugar to the mix. And then he let them have babies. The first generation of kittens had crooked teeth. Second generation of kittens had crooked teeth and scoliosis. Third generation of kittens had crooked teeth, some congenitally missing teeth, scoliosis, and hip dysplasias. And by the fourth generation, those cats could no longer have kittens. Now, I ask people when I'm talking to them about this, how many people do you know of right now? How many kids do you know of, just off the bat, off the top of your head, who have never needed braces? Right? Mm-hmm. We don't know any, right? How many people do you know of right now who suffer from chronic back, knee, neck, and hip problems? Mm-hmm. All of us, right? How many people do you know of right now who are struggling with fertility issues? It's 50% of dentists, by the way. 50% of female dentists struggle with fertility. Yikes. And the rest of the population isn't far behind.
Here's what I would say.
We are generations 3 and 4.
They should come work in our office, because everyone that works in our office gets pregnant within 3 months. I think it's something that we sterilize the room.
It happened. I will tell you that has been very common in my office as well. In 2020, I kid you not, we had 3 team members like have babies within 11 months of each other. I was like,
we average anywhere between 3 to 5 births a year. So yeah,
it's crazy.
We have two right now I can think of off the top of my head, and
yeah,
I haven't heard from it. It's early. It's April. We're recording this in May. Excuse me, early May. So
I'm fortunate. Most of mine, I'm fortunate right now because most of mine are like older, a little more mature. So we don't have a lot of people who are like looking to start families. But Lordy, yeah.
All right. So now we got a little bit here to wrap up. So now the business part, and the buying, the practice, and the loan, all those things combined. Now you've got this dynamic of personal health, diving deeper into the biological field of medicine and dentistry. What are some of the things that you would pass on to someone that you've learned in your business travels with your dental practice that you would have liked to have known earlier in your dental practice?
The first one was hire for disc, hire for personality, man. You can train anybody, but you cannot train a personality. So figure out what your disc is, because your disc may be different from my disc. And so you may work differently with other personalities. Figure out what works for you, in terms of those personalities. That's number one. The other thing that I've learned quite well is delegate that which you cannot do well. There are plenty of people, for example, who can do accounting. I suck at it. I suck at it so bad I've had an embezzler, so that was part of like the stress right before my cancer. 2 years before my cancer, 3 years before my cancer, my dad died and I had an embezzler. So it was a stressful year. And that was also the year that my daughter was born.
Yeah. Now, have you changed some of your systems in terms of the business, the accounting side, so that at least you can oversee some of it better?
So actually, I still suck at accounting. So what I did was I hired myself an accountant she literally left her job at the company she was at because she was a whistleblower, because she turned her company in for fraud. That was how she started out. She became a CPA. And so she was my patient before so I knew the whole story, et cetera, but she was my patient. So she became my CPA, and she takes care of all of the accounts payable. She takes care of all of the books balancing, all of the payroll, all of the stuff. I pay her a pretty penny for it, but I rest easy knowing that it's being balanced, because if I had to do it, God knows I still suck at it. I can't balance a checkbook.
You don't pay her as an employee, you pay her for her services then, correct?
Oh yeah, no, she is my accountant, and she gets paid I'm sure whatever hefty sum I pay her every month, to make sure that all of that stuff gets done.
But she's not necessarily only working in your office, is what I'm saying. She has.
Oh, no. She has her own small business.
Yeah,
she
so
works
she's
for a
hired.
dentist. She works for
Yeah.
She's got her own business. She's
Okay.
she's not my employee.
What else did you then hire people to help do for you? Because you have a very successful practice. So what other things did you do?
The other thing that I learned was, like I said, delegation. So
how about hiring and firing? Are you good at that?
Yeah, I can do that quite well.
Okay.
I've had to learn that. I hate doing it, and I'm much more patient than I should. I'm faster to hire and slower to fire, and it should be the other way around. I should be slow to hire and fast to fire. So
but
I'm
still
still
working
in general
are. I mean, we are the worst at it, but
we also, a big part of most of us are really, we believe in the good of human beings.
Champions. We champion
them. Yeah, we do. It's part of our nature and caregiving, right? So anyway, I have learned you do actually have to like people in order to work with them, because there was I've had a couple of team members where I didn't genuinely like them, and that did not work out well. So now I know that you genuinely have to like them in order to work with them. I also learned you cannot be their friend.
Yep.
You are not their friend. You are their employer, and you will never be more important to them. That's you're a job for them. Even if you love them, even if they love you, you're a job. And don't ever assume that they are your friend.
Let me ask you,
there has to be a boundary there.
Isn't that much tougher as a female?
Yes, it is. But I'd say yes, it is, but I've heard so many men also complain about those things, but yes, the whole, you've got all these women who are, also hormonal and everything, and it's difficult, but it's what it is.
What I mean is drawing that line. Like, we work together, we have a professional relationship versus the personal friendship part, right? That's what I mean. I think it's harder because I see with our female docs, I see that there's almost a little guilt pressure to socialize or to do XYZ. Whereas, listen, I love you guys. It's great. There's a professional relationship.
It initially, it was harder. Nowadays, it's not at all. Nowadays, it's like breathing. It's a skill, just like anything else, to learn that boundary and then keep it. You know what I mean? I'm very fortunate. I have a fantastic team now, but it wasn't always like that, and gosh, in 2021, I lost half my team, so you end up having to start from scratch a lot. It's okay. You know, each time my team has gotten better. I'm happy about it. Bless you.
Thank you. Now, when you started, just last question, if you want to share this or not. Your first year when you started from scratch to where you're at now, can you give us some idea what your business looked like number wise and what it looks like now? We know what it looks like, 7 operatories versus 1. And a couple of employees.
I was so
14.
happy when I reached $20,000 of production. You know, that after the 4th month, I reached 20,000. That was my break-even point. I was so excited, you know, in the month. And nowadays, like, you know, our BAM is 250.
Mm-hmm.
That's the BAM. And we aim for more than 300 if we can, you know, so it's a very different place.
But I don't think I don't think you get where you are unless you have some of what you had.
You know, everybody has their journey. So yeah. I had to have gone through every single thing I've gone through in order to get where I am. So absolutely.
Yeah. I think it gets too discounted too easily, especially you see where it's at. Oh, if I didn't do this, well, if I didn't do this, I probably wouldn't have done this, what I'm doing now. So I never discount it. Never have regrets.
No, it's a process. And the other thing is that people think, like, a lot of what I'm hearing now is there's this trend, you know, of people going, well, okay, I'll become biological because it's a way to get out of conventional dentistry. And I'm like, look, people can smell. If you're not authentic, they will smell it. You know, if you want to become biological, do your research, figure out if it really speaks to you. You know, and then
it comes out of your pores.
What I did. Yeah, it's literally like you've got to be able to be a true believer in order for people to get it. And I have a compelling story. I get it. The reason people come, they seek me out, they're like, damn, she beat cancer. You know, like it's good, but you know, like that's a genuine kind of story, and people need to authentically look for like their reason. Okay, why do you want to do this? Because if you're just doing it for the money, honey, it's more expensive to do biological dentistry than it is to do conventional. You know, like people are like, oh, you're taking your BAM is 250. Yeah, so that you understand in terms of the perspective of what it costs me versus what I do. I take home maybe 15% of what I produce, not, you know, definitely not 30% or more, which an owner should. The expenses in biological dentistry are outrageous. You know, do I still make a decent living? Yes, I make a good living, you know, but you know, you go into it knowing that you're going to spend so much money on CE, on the high-tech equipment. I mean, we have a Photona light walker. We've got our CEREC machine. We've got the 3 EMS, the airflow things for the guided biofilm therapies. We have ozone in every single room. Like literally, it's a state-of-the-art practice. Phenomenal.
It's awesome.
CBCT, all that stuff.
Okay, final question. If you could go back in time, anywhere, place, with anyone, anything, do anything, what have you, where would you go and why?
If I could go back in time and do anything or anything, wow.
It's right to, you know, sign the Constitution. You could watch the Gettysburg Address, anything, you know.
Wow. You should have prepped me for that question because I have to put some thought into that one.
It's really, it's what comes, it's organic. It's what the first thought that comes to mind. Because there's no wrong answer. So it's fun.
So right now, honestly, what I would like to do is if I could go back in time, I would have liked to have been able to like talk to either Weston Price or Francis Pottinger about their findings, because that, to me, I'm like, wow, they made some pretty neat research, you know.
That would have been my guess if I had to guess what you were going to say.
That's off the top of my head. I'm sure like other people would talk about things like, you know, what would you do? Like, would you want to meet Mother Teresa? I'm like, well, I met her when I was 6. So, you know, that it's a different perspective nowadays, you know, knowing what I know, gosh, yes, I'd like to have had a conversation with Weston Price. That would be pretty cool.
Awesome. Well, I really appreciate it. Now, if people want to get in touch with you, how can they reach you, your practice, your website? What would you like to share? How can people?
So I don't do email. In fact, I'm very, very hard to get a hold of through email. If you need to get a hold of me through email, then send the email to the practice, which is info@holisticdentalassociates.com. And then they will get the email to me. Literally, I kid you not, they print it out and hand it to me because I have 400,000 emails. I'm overwhelmed by them. So we don't do it that way. Then at that point, if it's, something where I can talk to somebody about it and they want to actually speak with me, then at that point we can text and call and so on and so forth. But yeah, if you want to reach me, start with info@Holistic Dental Associates and they'll make sure I get the email because I'm just horrible at it.
How about your website?
Holisticdentalassociates.com.
Okay. And you're in what community?
Spring, Texas. It's North Houston, Texas.
Okay. Folks, Dr. Teresa Scott, thank you for your time. I really appreciate it. Very enlightening. Very real. You kept it together. I don't know if I emotionally could have handled talking about that. So.
Oh, I'm over the trauma now, man. I got to tell you, that's only been this last year. Over the first 7 years, every time I talked about it, I'd bust into tears. I'm in a much better place now. I'm quite healed. I'm very happy. Thank you so much for having me.
You're welcome.
How old are they?
Yeah.
They are 15 and 16, and they
college
are
is around the corner.
They're actually in college already. They're doing a dual credit program at the Lone Star College. So my husband did a very good job educating them. So
got a little bit of you in them. That's all. You skipped 2
No,
grades.
he's got a PhD in biochemistry and genetics and
but you
molecular
skipped 2
biology. He
grades.
is a very bright man.
Yeah, but you skipped 2 grades.
I skipped 2 grades. I skipped 2 grades because we moved so often and, they were like, okay, what are you in? Okay, we've got 3 months left in the 4th grade. Okay, well, we'll put her in the 4th grade. Okay, she finished all of it. Okay, move her up to the 5th grade. That kind of thing. No, he is the smartest human being I've ever met. Seriously.
Well, you all make a good team. Good for you.
Well, thank you so much. All right, Sonny, thank you. It was a pleasure meeting you.
Nice to meet you too. Thank you.
All right, thanks.
Bye-bye.
Bye-bye.
Thanks for listening to the Fee-for-Service Dentist Podcast. If you would like to share your fee-for-service story, please fill out our contact form at ffsdentistry.com. Also, be sure to join our Fee-for-Service Dentistry Facebook group. For help starting your dental membership plan, visit dentalmembershipdirect.com and membershipmastercourse.com. Finally, for help with in-house financing, visit dentalfinancingdirect.com. And don't forget, your story is what you make of it. This is your name on the door and your reputation on the line. Thanks, everyone. We'll see you next time.
This has been a Rogue Media Network production.